Sexual activity is both an emotional bond and a fascinating biological process. From a racing heartbeat to the release of happiness hormones, your body experiences remarkable changes. So, what's happening inside you? First, for men, the sexual process can be divided into stages of arousal, peak excitement, orgasm, and recovery, with each stage involving distinct physiological changes. The arousal stage. When aroused, blood flows to the penis, causing an erection due to the release of nitric oxide and testosterone. At the same time, the heart rate increases from 60 to 70 beats per minute to 100 to 150 beats per minute, and breathing becomes faster to supply oxygen. Just to digress a bit, has anyone ever worried about a penis breaking during sex? The penis has no bones, so it can't break in the usual sense. However, a rare fracture or corporal rupture can occur from strong impact or improper positioning. With prompt treatment, recovery is possible, depending on the injury's severity. Back to the main topic, the head of the penis and surrounding area become highly sensitive, creating pleasurable sensations. Dopamine, linked to desire and excitement, is also released, intensifying pleasure and creating a sense of tension. The peak excitement stage. As stimulation increases, the Cowper's glands release pre-cum to lubricate the urethra and reduce urine acidity. The lower abdomen and pelvic muscles contract in preparation for orgasm. The orgasm stage. The orgasm stage in men is marked by increased heart rate, rapid breathing, and intense muscle contractions, especially in the pelvic area. Semen is ejaculated in 2 stages. First, it accumulates as sperm moves from the epididymis to the prostate, followed by a forceful expulsion due to contractions. This brings intense pleasure, lasting 5 to 10 seconds. Afterward, the body releases prolactin and oxytocin, inducing relaxation and satisfaction. Some men may close their eyes, clench their fists, or make sounds due to the intense pleasure. The recovery stage. After orgasm, the penis returns to a flaccid state and cannot become erect immediately. The recovery stage lasts from a few minutes to several hours, depending on age and health. After orgasm, some men feel the need to sleep, which is natural. A University of Groningen study found men sleep more than women post-intercourse due to the release of tension and chemicals like serotonin, oxytocin, and nitric oxide, which reduce stress and induce drowsiness. What about women? Essentially, women also go through 4 stages during sexual intercourse, just like men. However, there are differences in each stage. The excitement stage. When stimulated, blood flows to the vagina, clitoris, and labia, causing swelling and increased sensitivity, and the Bartholin glands secrete mucus for lubrication, while the vaginal walls expand to accommodate the penis. The plateau stage. The clitoris, with over 8,000 nerve endings, becomes the focus of sexual pleasure. The pelvic muscles in the uterus start to contract, preparing for orgasm. The orgasm stage. When reaching orgasm, the muscles of the vagina, uterus, and pelvic floor contract rhythmically 5 to 15 times over 20 to 30 seconds, creating a pleasurable sensation throughout the body and increasing oxytocin levels, enhancing the connection with the partner. Hormone fluctuations throughout the menstrual cycle can impact a woman's ability to orgasm and the intensity of pleasure. Many women experience the most intense orgasms around ovulation, days 12 to 16 of a 28-day cycle. While some women can have multiple orgasms, only about half regularly reach orgasm, with 20% rarely experiencing it, 20% having continuous orgasms, and 5% never feeling it. Many women sometimes fake satisfaction to avoid disappointing their partner. How can you tell if your partner is reaching peak pleasure? Look for physical signs: slight twitches, muscle contractions, faster, heavier breathing, and warmth or goosebumps. The vagina and pelvic floor may contract rhythmically. After orgasm, the body relaxes and a deep sense of satisfaction follows. Some women may release fluid during orgasm, known as female ejaculation. This is linked to fluid from the skein glands, near the urethra, which contains prostatic-specific antigen, PSA, and resembles urine but isn't exactly the same. However, this phenomenon is not common and not experienced by everyone. Additionally, some women may experience involuntary urination during orgasm due to increased pressure on the bladder and urethra. This is a normal physiological response, not a medical condition. The recovery stage. After orgasm, the vagina and clitoris return to their normal size, blood flow decreases, and the body relaxes. This recovery stage prepares the body for the next encounter. Unlike men, women can continue sexual activity immediately, though they may experience vaginal dryness or uterine cramps due to oxytocin. Additionally, many also feel their breasts become swollen, increasing by up to 25%. Although the sexual process in men and women differs, there are still some common points. Sex triggers the release of oxytocin and dopamine, promoting attachment, satisfaction, and excitement. It also burns 50 to 100 calories per encounter, depending on intensity. Sex reduces cortisol levels, stimulates endorphin release for pain relief and relaxation, and, according to Wilkes University, can boost the immune system by increasing immunoglobulin A, IgE, levels, which help fight illness. Both men and women react differently to stimuli, but the goal is the same. How have you experienced each stage? Share with us.